Doctors of Reddit, what's your thank God they came in for a second opinion moment? I can't count how many. I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else, as I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time. And of course, those are the patients that have a brain tumor show up on their CT scans. Edit. Well, this blew up. Big apologies to everyone, but I'm not a doctor. I work in the hospital alongside other doctors and I get the chance to see everyone they see. Apologies if I misled. That was not my intention. And I will make sure to be clearer next time. Were the tumors pressing on the Canadian cortex? Let's get that tumor OOT. I'm an emergency medicine doc in the Midwest, USA. The patient was transferred from rural nowhere to our tertiary care facility. Big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest X-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better, and wanted to send him to us. Sure, send away. An hour later the gentleman arrives, and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The X-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson. Look at your patient. Yet another morbid Monty Python sketch in this thread. We've done all we can with this patient, Dr. Sky Skimmer, and he just isn't responding. He has a big hole in his back and pneumonia, which we treated with a course of antibiotics. Sorry, he has what? Again? Quote, a big hole in his back and pneumonia. That you treated with, quote, antibiotics. I mean, obviously we also gave him IV fluids and put him on a ventilator. But, did you apply a bandage? Quote, respectfully, Dr. Sky Skimmer, do not bandage the lungs has been a point of emphasis for some time now. Tell me, have you been keeping up with the literature? Quote, underrated comment for the absolute accuracy. John Cleese was making a face in my head with this. Loved it. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine. That were melanomas. A lot of times people don't want full skin exams. There are lots of perfectly sane reasons for this. Time. Perceived cost. History of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Dermatology patient here. 37 years old. History of blistering sunburns. APPX 30 to 40 over the course of my life. Blonde hair, blue eyes. I go to the derm and ask for a full skin exam every damn year. 30 to 40 blistering sunburns. Dude. WTF. Asterisk asterisk edit. Asterisk asterisk guys. I'm white too. I understand how sunburns work. 30 to 40 blistering burns, i.e. second degree, is still extremely severe. Lol. Especially asterisk at age 37, asterisk. Asterisk asterisk edit 2, asterisk asterisk holy shit. Rip my inbox that is now full of 1. Old people explaining that sunscreen didn't always exist. 2. White people explaining that lighter skinned people burn easier. Oh wow, had no idea. Or 3. People talking about how many blistering burns they've had. I don't care. I'm not responding anymore. Congrats on your skin cancer. Asterisk asterisk edit 3, asterisk asterisk, for the handful of you that have mentioned burning while fully cloaked in shade. You should probably get checked out regardless of how pasty you are. Because that's not normal. I'm extremely pale, and I don't even burn unless I'm in the sun for at least 15 minutes. Not even in the Bahamas. Grew up in the 80s. Mom worked. We stayed home alone during the summer and often forgot sunscreen. Dad didn't believe in sunscreen. Anywhere from 0 to 2 blistering sunburns per summer month. For about 10 years. Means about 30 to 40. I wear sunscreen religiously now. I went to my former doctor about a mole on my arm that I thought had gotten larger, and asked him to biopsy it. He looked at it carefully and told me it was fine, but I insisted and things got a little testy. But he did it. It was a malignant melanoma, and had it gone 1 millimeter deeper I'd have been grounded for 5 years from my pilot job at best, or suffered dire health consequences at worst after a surgeon removed a big chunk of my arm, excising the melanoma and surrounding tissue. He told me to be sure to thank my regular doctor for saving my life. In the time since I've become well acquainted with your specialty as my first line of defense. Having moles mapped and checked every 6 months for a while, and now every year. It sure as hell isn't all Botox and laser hair removal. I am a semi-retired physician and I don't believe in second opinions. I much prefer 2 first opinions. Edit. Thank you readers. Never thought these 2 sentences would explode like this. Thank you very much for the silver and gold. Thanks to all who follow. This is an important distinction because often if the doctor forwards your file to a different doctor, they'll flavor it with their interpretation. Hi doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway just because we might as well while she was there. She was a 50-YO woman. Fairly normal exam. Perfect vision. Retinas showed healthy. But something about her pupils really bothered me before I dilated. We chatted about it and I asked her if she banged her head or anything weird and she said no. But suddenly reveals this crazy history of an old meningioma, a type of tumorous brain growth she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important. But we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward. Patient shows up in my office, ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea, was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover their bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. Edit. Thank you kind giver of gold and silver. It's good to be gilded. Edit. For those asking about the pupils, they were asymmetric, and the larger one reacted less robustly compared to the fellow eye. This was a marked change from her previous examinations where no pupillary defects were noted. Okay, eye docs are my best friends. I had massive sinus pressure and pain for about 2 years. Had been seeing an allergy specialist because the allergy specialist, GP, and I all thought the pain was because I am allergic to life. Which I am. Which didn't help anything. Then one day my right eye just stops adjusting from bright to dark and vice versa. Then during the adjustment time I would get extremely nauseous. My future hubby then points out we get one eye exam per year covered by ad insurance, and I haven't had my eyes checked in over 5 years. So we book an appointment. He squeezed me in later that week. I was still seeing a 20/15 vision, but my field of vision tests show I was about 70% blind in my right eye and 50% blind in my left. It's really amazing how the brain just compensates. I never noticed. He dilated my eyes and my optic nerves were swollen so large that the machine couldn't register it. And I broke an office record. I get told to head to the hospital ASAP. He gave us all the documentation we needed. Get to the hospital, and the moment the ear doc heard pulsating tinnitus and looked at my eye doc records, I got the world's quickest spinal tap. My opening pressure was over 60. Normal is like 15 to 18, depending on needle and method. And I shot spinal fluid across the room this year magically. My vision pretty much returned. My sinus pressure was gone, and I was no longer at risk of a brain hemorrhage. So, ophthalmologists have a very special place in my heart. He literally saved my life. Thank you so much for watching and have a good day.